Have you ever noticed a new rash, persistent itching, or sudden hives appearing after you've eaten something? As we get older, our bodies change, and so can our sensitivity to certain foods. What you eat could be silently triggering uncomfortable skin allergies. And for seniors, understanding these triggers is vital for maintaining comfort and health. Stick with us until the end of this video because we'll reveal the 7 types of food that commonly cause skin allergies in the elderly, helping you identify potential culprits and empowering you to make informed dietary choices for clearer, healthier skin. Before we begin, I would appreciate it if you like this video. You can help me continue to spread the old age lesson. If you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any videos. If you like this video, please comment number 1. If you don't like it, comment number 0 to let me know, so I can make a better video for you. Now let's get started. Here's a more detailed look at 7 types of food that commonly cause skin allergies in the elderly, along with important considerations. Type number 1. Shellfish. Shellfish, a broad category encompassing both crustaceans, e.g., shrimp, crab, lobster, crawfish, and mollusks, e.g., clams, mussels, oysters, scallops, squid, octopus, stand out as a predominant cause of adult-onset food allergies. The allergenic proteins within these marine creatures, particularly tropomyosin, are remarkably stable and resistant to heat, meaning cooking does not eliminate their allergenic potential. Mechanism of reaction. Upon consumption, the immune system of a sensitized individual mistakenly identifies these shellfish proteins as harmful invaders. This triggers an IgE-mediated immune response, leading to the rapid release of histamines and other inflammatory mediators throughout the body. Clinical manifestations. The reactions to shellfish can be swift and severe, often presenting with prominent dermatological symptoms. These include widespread hives, urticaria red, itchy welts that can appear anywhere on the body, often spreading rapidly. Intense pruritus, itching, a pervasive and often unbearable itching sensation accompanying the skin rash. Angioedema, swelling of deeper layers of the skin, particularly around the eyes, lips, face, and throat. This swelling can be disfiguring and, if it affects the airways, life-threatening. Gastrointestinal symptoms. Nausea, vomiting, abdominal pain, and diarrhea are also common. Respiratory symptoms. Wheezing, shortness of breath, and tightness in the chest may occur in more severe cases. Anaphylaxis. The most severe and potentially fatal reaction, involving a sudden, multisystemic allergic response that can include a rapid drop in blood pressure, dizziness, loss of consciousness, and respiratory distress. Management and cross-reactivity. Due to the high degree of protein similarity among various shellfish species, especially within crustaceans, cross-reactivity is a significant concern. If an older individual develops an allergy to one type of shellfish, allergists often advise strict avoidance of all types of shellfish, both crustaceans and mollusks, to minimize the risk of accidental exposure and severe reactions. Reading food labels meticulously and informing restaurant staff about the allergy are critical steps in managing this condition. Type number 2. Fish. Finned fish. Finned fish, such as salmon, tuna, cod, halibut, tilapia, and sole, represent another significant group of allergens for older adults. Unlike shellfish, where tropomyosin is the primary allergen, the major allergen in finned fish is often a protein called parvalbumin, beta-parvalbumin. Similar to shellfish proteins, parvalbumin is highly heat-stable, meaning that cooking methods like baking, frying, or grilling do not significantly reduce its allergenic properties. Some individuals may also react to fish gelatin derived from fish skin and bones. Mechanism of reaction. As with other IgE-mediated allergies, the immune system identifies parvalbumin or other fish proteins as threats, triggering the release of inflammatory chemicals. Clinical manifestations. Reactions to finned fish can vary in intensity but commonly involve dermatological symptoms, skin rashes, including hives, urticaria, and generalized redness, erythema, accompanied by intense itching. Gastrointestinal symptoms. Nausea, vomiting, stomach cramps, and diarrhea can occur, sometimes within minutes of ingestion. Respiratory symptoms. Rhinitis, runny nose, nasal congestion, sneezing, and asthma-like symptoms such as wheezing, coughing, and shortness of breath are frequently reported. Oral allergy syndrome, OAS in some cases, localized itching or tingling in the mouth and throat may be the initial symptom. Anaphylaxis. While less common than with peanuts or shellfish, Severe systemic reactions, including anaphylaxis, are possible and require immediate medical attention. Management and specificity. While cross-reactivity between different species of finned fish can occur, especially between fish with similar parvalbumin profiles, it's also possible for an individual to be allergic to one type of fish and tolerate others. For example, some individuals may react to cod but not tuna. However, given the potential for severe reactions, allergists often recommend a cautious approach, which may include avoiding all fish initially, followed by supervised oral challenges in a medical setting if specific fish tolerance is suspected. Careful label reading for hidden fish ingredients, e.g., in sauces, surimi, or some vitamin supplements, is crucial. If you are still watching this video and finding these lessons useful, please comment number 1 below to let me know that you are still watching this video with me. Thank you for your valuable time. Type number 3. Peanuts. Peanut allergy is widely recognized for its potential to trigger extremely severe and life-threatening reactions, making it one of the most dangerous food allergies. While historically associated with childhood, there has been a notable and concerning rise in late-onset peanut allergies in adults, including the elderly. The allergenic proteins in peanuts, e.g., ERA H1, ERA H2, ERA H3, are highly potent and stable. Mechanism of reaction. Exposure to even minute amounts of peanut protein can rapidly provoke an exaggerated IgE-mediated immune response, leading to a cascade of inflammatory reactions throughout the body. Clinical manifestations. The spectrum of reactions to peanuts is broad but often leans towards the severe end. Dermatological symptoms. Reactions can range from mild local itching and hives to widespread, rapidly spreading redness and significant swelling, angioedema. Gastrointestinal symptoms. Abdominal pain, cramping, nausea, vomiting, and severe diarrhea are common and can be debilitating. Respiratory symptoms. Nasal congestion, sneezing, shortness of breath, wheezing, and a constricted feeling in the throat are critical signs of a progressing reaction. Cardiovascular symptoms. A sudden drop in blood pressure, hypotension, dizziness, lightheadedness, and even loss of consciousness are hallmark signs of anaphylactic shock. Anaphylaxis. Peanut allergy is a leading cause of anaphylaxis, a medical emergency characterized by a rapid, multisystemic allergic reaction that can be fatal if not treated immediately with epinephrine. Management and strict avoidance. Given the high risk of severe and potentially fatal reactions, strict avoidance of peanuts and all products containing them is essential for individuals diagnosed with a peanut allergy. This requires meticulous label reading, as peanuts can be hidden ingredients in a vast array of processed foods, candies, baked goods, and even unexpected items like some Asian dishes or vegetarian products. Cross-contamination in food preparation environments, e.g., shared fryers, utensils, is also a significant concern. Individuals with peanut allergies are strongly advised to carry 2 epinephrine auto-injectors, e.g., EpiPen, at all times and to be educated on their proper use, along with wearing medical alert identification. Regular consultation with an allergist is crucial for ongoing management and education. Type number 4. Tree nuts. This expansive and incredibly diverse category of tree nuts includes a wide array of culinary staples and snacks, each with its unique flavor profile but a shared, significant potential for triggering severe allergic reactions. Common examples that frequently cause allergic responses include almonds, cashews, walnuts, hazelnuts, pecans, pistachios, and the less commonly encountered but equally allergenic Brazil nuts and macadamia nuts. The proteins encapsulated within these nuts are potent allergens, capable of initiating immediate, systemic, and sometimes life-threatening responses in sensitized individuals. The nature of tree nut allergies is particularly challenging because, much like peanut allergies, they are often lifelong. This means that individuals who develop a tree nut allergy, especially in childhood, typically do not outgrow it, requiring lifelong vigilance. The spectrum of reactions can range from mild to extremely severe, but the constant and ever-present danger of anaphylactic shock looms large. Anaphylaxis is a rapidly progressing, severe, and potentially fatal allergic reaction that can affect multiple organ systems simultaneously, leading to symptoms like a sudden drop in blood pressure, airway constriction, and widespread hives. For this critical reason, individuals with a confirmed tree nut allergy are almost always advised to carry epinephrine auto-injectors, commonly known by brand names like EpiPen or AviQ, at all times and be meticulously vigilant about avoiding any form of exposure. Dermatological symptoms are among the most frequently observed and often the first indicators of a tree nut allergy. These can manifest rapidly after exposure, presenting as a sudden outbreak of raised, intensely itchy welts known as hives, urticaria, across the body. Accompanying these can be generalized, severe itching, pruritus, and significant swelling, angioedema, particularly noticeable around the face, lips, eyelids, and throat. Beyond the skin, tree nut allergies can impact multiple bodily systems. Gastrointestinal symptoms are common, including nausea, vomiting, abdominal pain, and diarrhea. Respiratory distress can quickly develop, characterized by wheezing, shortness of breath, tightness in the chest, and nasal congestion. Cardiovascular signs, often indicative of more severe reactions, can include a dangerous drop in blood pressure, dizziness, lightheadedness, and fainting. Neurological symptoms like confusion or a sense of impending doom can also occur in severe cases. A critical and often complex aspect of tree nut allergies is the high likelihood of cross-reactivity. This phenomenon means that an individual who is allergic to one type of tree nut is at a significantly elevated risk of also being allergic to other types of tree nuts, even if they haven't been directly exposed to them. For example, someone allergic to walnuts might also react to pecans, or someone allergic to cashews might react to pistachios. Due to this unpredictable nature of cross-reactivity, medical professionals, especially allergists, frequently recommend a comprehensive avoidance strategy. If an allergy to even a single type of tree nut is definitively confirmed through diagnostic testing, such as skin prick tests or specific IgE blood tests, the individual is often advised to avoid all tree nuts. This broad precautionary measure is designed to minimize the risk of accidental exposure to an unknown or unconfirmed tree nut allergen and, crucially, to prevent potentially severe, life-threatening reactions. Comprehensive patient education is therefore paramount, focusing on meticulous label reading to identify hidden ingredients, understanding the risks of cross-contamination in shared kitchens, restaurants, and food manufacturing facilities, and recognizing that even trace amounts of tree nut protein can trigger a reaction. If you are still watching this video and finding these lessons useful, please comment number 2 below to let me know that you are still watching this video with me. Thank you for your valuable time. Type number 5. Cow's milk. Dairy. While allergies to cow's milk are indeed most commonly diagnosed and often outgrown in infancy and early childhood, it's a critical misconception to view them solely as pediatric concerns. Milk allergies can persist well into adulthood, and, less commonly but significantly, can even develop for the first time in older adulthood. This makes it an important consideration across all age groups. The immune system's misdirected response in a milk allergy targets specific proteins found in cow's milk, primarily whey and casein. Whey proteins, such as alpha-lactalbumin and beta-lactoglobulin, are found in the liquid portion of milk, the watery part that separates from curds. Casein proteins, including alpha-S1 casein, beta-casein, and kappa-casein, are found in the solid curd portion. Both types of proteins can act as potent allergens, triggering a robust and potentially severe immune reaction in sensitized individuals. When an allergic individual consumes or is exposed to cow's milk, their immune system mistakenly identifies these otherwise harmless proteins as threats. This triggers an immunological cascade, leading to the release of inflammatory mediators such as histamine, which are responsible for the wide array of allergic symptoms. Skin reactions are among the most prominent and frequently observed manifestations of a milk allergy. These can appear rapidly after ingestion and include the sudden eruption of hives, urticaria, itchy, raised, red welts that can appear anywhere on the body. For individuals with pre-existing skin conditions like eczema, atopic dermatitis, milk exposure can trigger severe eczema flare-ups, characterized by intensified dryness, itchiness, redness, and inflammation of the skin. Generalized and persistent itching, pruritus, even without a distinct rash, can also be a symptom. Beyond the skin, milk allergy can affect the gastrointestinal system, causing nausea, vomiting, diarrhea, and severe abdominal cramps. The respiratory system, leading to wheezing, coughing, nasal congestion, and shortness of breath. And in the most severe cases, it can trigger anaphylaxis, a life-threatening systemic reaction requiring immediate medical intervention. It is absolutely crucial to draw a clear distinction between a true cow's milk allergy and lactose intolerance, as their underlying mechanisms, symptoms, and management strategies are entirely different. A true milk allergy is an immune system response to milk proteins, potentially leading to severe, systemic, and life-threatening reactions. In contrast, lactose intolerance is a digestive issue caused by a deficiency of the enzyme lactase, which is necessary to break down lactose, the sugar present in milk, into simpler sugars for absorption. Symptoms of lactose intolerance are typically confined to the digestive tract, such as bloating, gas, abdominal pain, and diarrhea after consuming dairy, and are generally not life-threatening, nor do they involve the immune system. Accurate medical diagnosis, often involving an allergist and specialized tests, like specific IgE blood tests, skin prick tests, or supervised oral food challenges, is essential to differentiate these conditions and ensure the correct management plan is implemented. For individuals with a confirmed milk allergy, strict and complete avoidance of all dairy products and ingredients derived from milk is necessary. This requires meticulous label reading to identify hidden milk proteins in processed foods, an understanding of cross-contamination risks, and often a re-education on dietary sources of calcium and vitamin D to ensure nutritional adequacy. Type number 6. Wheat allergies are triggered by an adverse immune reaction to specific proteins found within wheat. While gluten is undoubtedly the most widely recognized protein in wheat due to its association with celiac disease, a wheat allergy can involve reactions to various wheat proteins, not solely gluten. This distinction is critical. It is imperative to differentiate a true wheat allergy from celiac disease. While both necessitate strict dietary changes involving the avoidance of wheat, their underlying mechanisms are entirely distinct. Celiac disease is a lifelong autoimmune condition where the ingestion of gluten triggers an immune response that damages the lining of the small intestine, leading to malabsorption of nutrients. A wheat allergy, however, involves a classical IgE-mediated immune response to one or more wheat proteins, leading to immediate allergic symptoms. Their diagnostic criteria, long-term health implications, and specific triggers, e.g., celiac disease reacts exclusively to gluten, whereas a wheat allergy can react to other wheat proteins besides gluten, differ significantly. For individuals with a wheat allergy, consuming wheat can provoke a diverse range of symptoms, with skin manifestations being a prominent and often rapid indicator. These can include generalized and intense itching, pruritus, the sudden development of raised, red, and itchy hives, urticaria, and widespread redness or flushing of the skin. Beyond dermatological signs, a wheat allergy can impact multiple bodily systems. Gastrointestinal distress is common, presenting as nausea, vomiting, diarrhea, and severe abdominal pain. Respiratory symptoms can range from mild, nasal congestion, sneezing, to more severe, such as asthma-like symptoms, wheezing, shortness of breath, chest tightness. In the most severe cases, a wheat allergy can escalate to anaphylaxis, a life-threatening systemic reaction that requires immediate emergency medical attention. The ubiquitous nature of wheat in the modern Western diet presents a significant and often overwhelming challenge for individuals with a wheat allergy. Wheat is a fundamental ingredient in an extensive array of processed foods, baked goods, pastas, cereals, sauces, seasonings, and even unexpected non-food items like cosmetics and Play-Doh. This pervasive presence makes strict dietary management particularly arduous, especially for elderly individuals who may have less familiarity with the intricacies of extensive food label reading or who might rely more heavily on convenience foods and pre-prepared meals. Careful label reading is paramount, as wheat can be present under various, sometimes less obvious, names, e.g., farina, semolina, spelt, durum, bulgur, couscous, einkorn, emmer, kamut, triticale, modified food starch, hydrolyzed vegetable protein. Furthermore, awareness of hidden sources of wheat, such as certain soy sauces, salad dressings, processed meats, some candies, and even some medications, is crucial. Cross-contamination in shared kitchens, restaurants, bakeries, and food manufacturing facilities poses another substantial risk that demands constant vigilance. Even trace amounts of wheat protein, transferred from shared utensils or surfaces, can trigger a reaction in highly sensitive individuals. Dietary management for a wheat allergy involves the strict and complete avoidance of all wheat-containing products. This often necessitates a fundamental shift in dietary habits, embracing naturally gluten-free grains such as rice, corn, quinoa, millet, sorghum, and oats, if certified gluten-free to avoid cross-contamination with wheat during processing. Consulting with an allergist for accurate diagnosis and a registered dietitian specializing in food allergies is highly recommended to ensure the individual maintains adequate nutrition while adhering to a strict wheat-free diet and to develop strategies for managing accidental exposures. If you are still watching this video and finding these lessons useful, please comment number 3 below to let me know that you are still watching this video with me. Thank you for your valuable time. Type number 7. Fruits and vegetables. Oral allergy syndrome. Reactions to raw fruits and vegetables, while often perceived as less severe than other food allergies, are remarkably prevalent in adults, frequently manifesting as oral allergy syndrome, OAS, also known as pollen food allergy syndrome. This fascinating immunological phenomenon occurs due to a cross-reactivity between proteins found in various pollens and similar proteins present in certain raw fruits and vegetables. When an individual is already allergic to a specific type of pollen, e.g., birch, ragweed, grass pollen, their immune system, upon encountering the structurally similar proteins in the food, mistakenly identifies them as the pollen allergens. The characteristic symptoms of OAS are typically localized to the oral cavity, lips, and throat, appearing almost immediately, within minutes, after ingesting the raw fruit or vegetable. Individuals commonly report an itchy or tingly sensation in the mouth, lips, and tongue, often accompanied by mild swelling, redness, and occasionally a scratchy or irritated throat. Unlike more severe food allergies, systemic reactions, affecting multiple body systems, are less common with OAS, though they can occur in rare instances. A key distinguishing feature of OAS is that cooking or processing these allergenic foods often denatures the problematic proteins, rendering them harmless and allowing individuals to safely consume them in their cooked form. Common culprits associated with OAS include, but are not limited to, apples, carrots, peaches, plums, cherries, melons, like watermelon and cantaloupe, bananas, and tomatoes. The specific fruits and vegetables that trigger reactions often correlate with the individual's underlying pollen allergy, e.g., birch pollen allergy is often linked to apple, peach, and carrot reactions. Ragweed pollen allergy is linked to melon and banana reactions. Important considerations for seniors regarding oral allergy syndrome and other food-related skin reactions. The aging process introduces several unique complexities when evaluating and managing food allergies, including OAS, in the elderly population. Changes in immune response. Immunosenescence. The immune system naturally changes with age, a phenomenon known as immunosenescence. This can lead to a less robust or atypical immune response to allergens. Consequently, allergy symptoms in seniors might be less obvious, less severe, or even delayed compared to younger individuals, making accurate diagnosis particularly challenging. The classic immediate onset and clear-cut symptoms seen in younger adults may be blunted or masked in the elderly. Polypharmacy and medication interactions. A significant proportion of seniors take multiple medications, polypharmacy, for various chronic conditions. Some of these medications can profoundly interfere with allergy symptoms, either by masking them, e.g., antihistamines taken for other reasons, or by directly causing skin reactions themselves, e.g., drug-induced rashes. Furthermore, certain medications can impact the results of allergy diagnostic tests, leading to false positives or negatives. It's crucial to review a senior's complete medication list when evaluating suspected food-related reactions. Underlying health conditions and differential diagnosis. Chronic health conditions prevalent in the elderly, such as kidney disease, liver disease, thyroid dysfunction, diabetes, and certain autoimmune disorders, can independently manifest with dermatological symptoms like generalized itching, pruritus, dry skin, xerosis, or various types of rashes. This makes it significantly more difficult to pinpoint food as the sole or primary culprit for new skin reactions, necessitating a thorough medical evaluation to rule out other potential causes. Nutritional status and deficiencies. Nutritional deficiencies, which can be more common in the elderly due to dietary restrictions, malabsorption, or decreased appetite, can impact overall immune function and skin health. Deficiencies in essential micronutrients like vitamin D, zinc, iron, and various B vitamins can compromise skin barrier integrity and influence inflammatory or allergic responses, potentially exacerbating or mimicking allergic reactions. Severity of reactions and anaphylaxis risk. While OAS symptoms are typically mild, it is imperative to remember that any new or worsening skin reaction following food consumption in an elderly individual should be taken seriously. Although less common with OAS, severe systemic reactions, including life-threatening anaphylaxis, are possible at any age, including in the elderly. The elderly may also be more vulnerable to the severe consequences of anaphylaxis due to pre-existing cardiovascular or respiratory conditions. Therefore, what might appear as a mild initial reaction should not be dismissed, especially if there's a progression of symptoms. When to seek medical attention. Given the complexities described above, prompt medical evaluation is crucial if an elderly individual experiences any new, recurrent, or concerning skin reactions after consuming food. Immediate medical attention, emergency services, is necessary if symptoms are severe, widespread, rapidly worsening, or accompanied by systemic signs such as difficulty breathing, wheezing, swelling of the face, lips, or throat, angioedema, dizziness, fainting, a sudden drop in blood pressure, or severe gastrointestinal issues, e.g., intractable vomiting, severe diarrhea, abdominal pain. Even milder, persistent, or recurring symptoms warrant a visit to a healthcare provider, ideally an allergist or immunologist, for a comprehensive evaluation. These specialists can conduct appropriate allergy testing, which may include skin prick tests, SPT, or specific IgA blood tests, often called RAST or immuno-CAP tests, to identify specific food and pollen triggers. Based on the diagnostic findings, they can provide personalized advice on safe dietary modifications, strategies for avoiding allergens, and, if necessary, prescribe medications like antihistamines or recommend an epinephrine autoinjector for managing potential severe reactions. A collaborative approach involving the individual, their caregivers, and healthcare providers is essential for optimal management and to ensure the safety and nutritional well-being of the elderly individual. Now that we've thoroughly explored the 7 types of food that commonly cause skin allergies in the elderly, from the obvious culprits like shellfish and peanuts to the often surprising triggers of oral allergy syndrome from fruits and vegetables, we truly hope you feel more informed and empowered. Understanding these potential connections between your diet and your skin health is a crucial step towards greater comfort and well-being in your golden years. We've discussed how the aging immune system can react differently, the importance of distinguishing between true allergies and intolerances, and why you should always consult a professional for a proper diagnosis. It's not just about avoiding discomfort, it's about proactively managing your health for a better quality of life. We'd love to hear from you. What's one key piece of information or perhaps a specific food type you learned about in this video that you'll be more mindful of, or even bring into practice in your daily life? Share your insights and experiences in the comments below. Your input could help someone else navigate similar challenges. If you found this discussion helpful, please remember to leave your comment below, and don't forget to like, share, and subscribe to our YouTube channel for more valuable health tips tailored for seniors.